Well, welcome back to Everyday Iowa. Time is winding down for Medicare enrollment. Are things winding down for you?
Not really.
Not really. Well, this is Brian Thompson of Peritia Advisors. Brian, first, why don't you tell us what Peritia means? We were just talking about it.
Peritia is Latin for expertise.
I like it.
When I was opening the agency, I was looking for a combination of Thompson and insurance that somebody else didn't already own, and I couldn't find one, so I decided to be clever.
Sometimes you have to do that. Well, Peritia Advisors, do you still have appointments available for people?
I do. We will find a way to get people in. We have probably 15 or 20 next week in the regular business hours, and then I've been in the office as late as 2 a.m. So.
Oh my gosh, that's a lot of work, but it's a pretty busy season. What would you say to somebody who is saying, why can't I just do this all over the phone?
There's too many changes. There's too many things that are hidden unless you actually know the products and know the policies and know why this works this way or that works that way. I had a lady in my office last night. She says, I picked this one. I know it's the right one for me, but I thought I'd have you double check it. And 4 minutes later, she's like, this plan is terrible, isn't it? I said, yeah, for you, in this particular case, it is.
Yes. And it changes year to year, so if you know last year, you might not know this year.
Exactly.
What changes?
Everything. The prescription drugs can change. The dental plans can change. They can add. They can go down. They can go away. Just because your drugs have been covered for the last 5 years on the plan you're on doesn't mean they will be next year.
Yeah.
So something that didn't cost you anything last year could be $1,000 this coming year because it's not covered at all.
And you might not know it.
Right.
Another reason things get more confusing, scams get more intelligent.
They do, and they're going to hit their peak here in the next 2 weeks.
Okay, so what should...
Because in open enrollment, the last application that is entered is the one you actually end up with. So all the work you did all the way through from the 15th to December 6th, if you answer the phone on the 7th and talk to somebody, they can change your plan that day, and that's the last plan.
Are there ways to spot a scam?
Nobody should ever call you about Medicare unless you have specifically asked them to.
Right. So
you either have to click on something online or sign a piece of paper that says they have your permission to give you a call.
So if somebody meets with you and you call them, then they know this is legit.
Right.
So they've met you face to face.
But anybody who's calling to help you get your new Medicare card is a liar.
Okay.
Anybody who's calling because there's a new program available in Iowa that you've never seen before is a liar.
So
it's just a scam to keep you on the phone and change your plan, and usually not in your best interest.
that's scary.
It is.
So if somebody wants to meet face to face with you, you can walk them through all of this.
Absolutely.
But when the cutoff date comes, are we totally locked in?
No. There's every time I give you a hard rule, there's always an exception somewhere. If you feel that you've been scammed, if you feel that the plan that somebody put you on is not the right plan, we can have you out before the 31st and back to whatever you had previously. If it's not until after the first of the year that you realize that maybe this is not the right plan for you. In many cases, we can make a change after the first of the year to something else.
Right.
So you're not necessarily locked in just because. Worst case scenario, we have to call Medicare itself and submit a grievance and change something that way. But there are ways.
But it'd be important to have an agent.
Somebody that knows the system, yeah.
Yes. About how long is an appointment if somebody comes in and wants to speak with you? Depends?
As long as it needs to be. I had one yesterday that ran almost 3.5 hours. I've had appointments that ran. I just have a question about this benefit on the plan, and I want to keep my plan. Well, we were done in 5 minutes.
Right. So it really is.
It really, yeah. The more questions you have, the longer we'll be there.
Well, it's really important to meet face to face.
Absolutely.
And ask those questions before you're locked in. How can people get into? Well, what were you going to say?
I was just going to say, but the next 2 weeks, you're going to see more scams than anything else because that's how they get you locked in before the 7th. And you can't. Most people don't know how to make a change after the 7th.
Right.
Or don't even realize that they've made a change. Give me a call, 319-841-2010. We will get you on the calendar.
I really appreciate it. You're a busy guy, so thank you for being here.
Absolutely.